Drug dose calculation. Q3. A 55 to 1B child is to be started on phenytoin 5 mg per kilogram per day in 2 divided doses for 3 days, then placed on a maintenance suspension of 30 mg per kilogram per day. Phenytoin is available as a pediatric oral suspension of 30 mg, 5 ml. What volume of drug will you administer at each dose for the first 3 days? As a maintenance dose, what will you give in a single dose and in 2 divided doses? Understanding the given information. 1. The child weighs 55 pounds. 2. The initial dose of phenytoin is 5 mg per kilogram per day, to be given in 2 divided doses for the first 3 days. 3. After that, a maintenance dose of 30 mg per kilogram per day is prescribed. 4. Phenytoin is available as a pediatric oral suspension, with a strength of 30 mg per 5 ml. 5. We need to calculate how much volume to give for the first 3 days. What volume to give as the maintenance dose? Convert weight to kilograms. To convert the child's weight from pounds to kilograms, we use the standard formula, 1 kilogram equals 2.2 pounds. So, to get the weight in kilograms, we divide the weight in pounds by 2.2. That means, weight in kilograms equals 55 divided by 2.2. Which gives us 25 kilograms. We will now use this weight for all further dosage calculations. Step 3. Calculate total dose for the first 3 days. For the first 3 days, the child is to receive a loading dose of 5 mg per kilogram per day. We start by multiplying the dose by the child's weight. 5 mg per kilogram per day times 25 kg equals 125 mg per day. Since the dose is to be given in 2 divided doses, we divide 125 mg by 2. 125 divided by 2 equals 62.5 mg per dose. So, for the first 3 days, the child should receive 62.5 mg twice a day. Step 4. Calculate volume to give for each loading dose. We now need to convert the dose in milligrams to milliliters using the drug concentration. We know that 30 mg of phenytoin equals 5 ml of suspension. To find out how many milliliters are needed for 62.5 mg, we set up a proportion, 62.5 divided by 30, then multiplied by 5. That gives us 62.5 divided by 30 times 5 equals approximately 10.4 milliliters. Pushpin. So, for the first 3 days, you should administer 10.4 milliliters twice a day. Step 5. Calculate maintenance dose. After the first 3 days, the child is to be placed on a maintenance dose of 30 mg per kilogram per day. We begin by multiplying the dose by the child's weight. 30 mg times 25 kg equals 750 mg per day. If the full dose is given once daily, the child would receive 750 mg at once. However, if the dose is to be divided into 2, we divide by 2. 750 divided by 2 equals 375 mg per dose. So, the maintenance dose would be 375 mg, given twice a day. Step 6. Convert 375 mg to volume. Now, let's convert the maintenance dose from milligrams to milliliters. We use the same concentration, 30 mg equals 5 milliliters. To find out how many milliliters are needed for 375 mg, we set up a proportion, 375 divided by 30, then multiplied by 5. That gives us 375 divided by 30 times 5 equals 62.5 milliliters. Pushpin. So, for the maintenance dose, the child should receive 62.5 milliliters twice a day. Final answer, for the first 3 days, administer 10.4 milliliters of phenytoin twice a day. Then, for the maintenance dose, administer 62.5 milliliters twice a day. Thank you for watching the video. If you found it helpful, don't forget to like the video, subscribe to the channel, and hit the notification bell for more content like this. Drop a comment below if you have any questions or need further clarification. Thanks again, and see you next time.